Assalamu alaikum. My name is Junaid and I am the student of final year. So first of all, thank you so much, sir, for giving us this opportunity to speak. And here our two members of our group. Our group is Group F. Dr. Haroon and Dr. Maham will explain or give us the demo, whatever I will explain from the PPT. With your permission, sir.
Please.
So here are some steps of history taking. First, we have the general information of the patient. Then we will go for the chief complaint. Then we will go for history of presenting illness. Then we will take the past history, personal history, social history, family history, and treatment history. And in last, we will take any history of allergy to drug or food and immunization history. The most important steps for patient, we will take the patient vitals. We will check the pulse rate, blood pressure, temperature, respiratory rate, weight, and saturation of oxygen. And the most important, as we studied, there is Socrates. So steps for pain history. First we will check the site of the pain, onset, character, radiation, association, and timing, and exacerbates mean what are the aggravating factors and what are the relieving factor and what is the severity of the pain. So here we go from the first step. First step is general information of the patient. So there are some steps in here like name, age, sex, religion, occupation, marital status, either the patient, he or she is married or unmarried, and we will ask the address, date of admission, and date of examination. Now Dr. Maham and Dr. Haroon will give us the demo. How they will take the general information of the patient.
Assalamu alaikum, sir. I'm Dr. Maham and I'm here to have your regular checkup.
Okay.
Can you permit me?
Okay.
Thank you, sir. Sir, can you please tell me what is your name?
My name is Haroon.
And what is your age?
I'm 24 years old.
Can I start again, sir?
Yes, please.
Thank you. Assalamu alaikum.
Walaikum salam.
I'm Dr. Maham and I'm here to have your regular checkup. Can you please allow me?
Yes, sure.
Thank you. Sir, can you please tell me your name?
My name is Haroon.
Okay. And what is your age?
I'm 24 years old.
Okay. Can you please tell me what is your occupation?
I'm student.
Okay. Can you please tell me, are you married or unmarried?
Unmarried.
Can you please tell me your address?
I'm from East University, Eastern City.
Sir, can you please tell me what problem have brought you here today?
Doctor, I have temperature from last few days.
Okay, next. So we will go further. Here, in general information of the patient, if we can ask the marital status here. If we forget, then we can also ask him the personal information.
Ask him to leave the class.
So,
Not now. Yes, please.
yes, sir. So then we will we will write the chief complaint. The most important point in chief complaint, we will write the presenting complaint in chronological order. What is chronological order? We will say do not write two symptoms in one sentence. Like if we write if some patient has a pain in abdomen and jaundice, but we will not directly write the diagnosis. There is a jaundice. We will only write the symptoms. Like better to write as pain in right upper half of the abdomen for 2 years and yellowish discoloration of eyes and urine for 2 years. Okay? And do not write long list of symptoms in chief complaint. Write the 2 to 3 symptoms in chief complaint. Okay, please.
Sir, can you please tell me what problem has brought you here today?
Doctor, I have temperature from last few days.
Okay, temperature from last 2 days. Okay, when did it
Few
start?
days, from few days.
Okay, last few days. Sorry for that. Okay, can you please tell me when did it start?
Almost 10 days ago.
10 days ago. Okay. How how did it start? Can you please elaborate it further?
Uh, in the last 10 days, I feel temperature, and after some days, I have loose motion almost from 6 to 7 days, and also feel very lethargy, weakness in the body. So I came to the hospital.
Okay, thank you. And any other symptom you feel with fever and tiredness? Yes?
No, that's all.
Thank you, sir.
So now we will go for history of presenting illness or present illness. So we will start with a comment that the patient was apparently well before this episode of illness, which started months or years back. So we will ask history. We will take the history, what the disease or what the symptoms he has.
Actually, you should be there.
Okay, sir.
We have a pointer.
No, sir.
Shabash. Okay, you already doing good job. Okay, Shabash. Continue.
Okay, elaborate each chief complaint in one paragraph in history of presenting illness, present illness. If the patient chief complaint are pain, jaundice, vomiting, write detail about pain, jaundice, vomiting in 3 different paragraphs, maintaining the chronological order. In chronological order, I would like to explain once again. We will not directly write the diagnosis. We will write only symptoms. Once chief complaints are elaborated, then write about other relevant symptoms. Symptoms pertaining to different systems should be asked and relevant symptoms are to be written. So here we will also
Just summarize the previous slide. Summarize. In summary, you will say you have to write history of presenting illness as a paragraph,
yes, sir.
and for each symptom there will be a different paragraph, and you will start the paragraph by saying the patient was apparently well before this. Before what? Then you explain. Okay, he had a pain, abdomen 10 days ago. If there is a fever, that's another complaint, right? You have to give another paragraph for that, and then you can say the patient did not had fever this much days ago, and he started fever how much, if he recorded, yes, and what was the onset, night fever, daytime fever.
Yes.
Okay, please
Yes, sir.
continue.
Sir, as sir explained, so here is the, if we have like pain, we will ask questions about pain, like onset, all the 8 or 9 steps. We will write in one paragraph, and other symptom as well. So next, in review of systems, we will generally check the general health. We will check the appetite, loss of energy, chills, weakness, weight change, disturbed sleep, night sweats, itching, rash, fever, fatigue. Dr. Maham will explain how will we ask these questions from the patient. Please.
Thank you, sir. Okay. Sir, I'm asking you some further questions. Can you please elaborate in a better way?
Yes.
Thank you, sir. Sir, you have told me that you have fever from last 10 days.
Yes.
And you feel tiredness, and with that you have loose motion from 6 to 7 days.
Yes.
Okay. I'm going to ask you furthermore questions. Please cooperate with me.
Okay,
Thank you.
sure.
Thank you. Sir, do you feel any change in your food habit? For example, like do you feel decrease or increase in the food habits? Do you eat more or less?
I think there is decrease in appetite. I
Okay.
feel decrease in appetite.
When your fever starts, or when you were before that?
After I have loose motion from 6 to 7 days.
Okay, thank you, sir. Have you observed any change in your weight? Did you feel it gain or it is loosed?
Not significantly, but a minor change in weight.
Okay, thank you. Do you feel any weakness, tiredness in your body continuously or with intervals?
Weakness is continuously.
Okay, thank you. Do you feel or observe any fever continuous or interval with intervals?
Fever is continuous.
Okay, have you measured it at home?
Yes, I measured it.
How much it is?
It is 38 to 39.
Okay, you have recorded it.
Yes,
Okay,
I
thank
recorded.
you. Do you have any headache with it?
Yes, I have had it.
For how much time?
it is periodically, not continuous, but it is periodically.
Okay.
Sometimes I have headache, sometimes it is gone.
The headache is complete headache
Yes,
or
in the food.
some particular areas?
Yes, in the food.
Okay, thank you. Do you have any head injury? Do you have do you have headache due to any head injury or?
No, I don't have any headache.
Headache. Okay, thank you. Then, sir, will you allow me to? Sir, will you tell me? Do you feel any change in vision, like decrease in vision or any blurry vision?
No, there is no change in me.
Okay, thank you. And do you feel any pain in your ears or any ringing sounds in
No.
your ear?
No pain.
Okay, thank you. Or do you feel any bitter taste when you eat some dessert or sweet dishes?
No, there is no change in taste.
Okay, no change in taste. Or do you feel any awareness of the heartbeat when you sleep, when you do hard work, something like that? No?
Okay, Bache, Maham, I would like to, these questions are very good and precise. I would like you to tell them about these questions we have written, okay? So, for the taste, we can ask this, for this, we can ask this. For example, we have these questions, right?
Yes, sir.
Where are the questions started? From here.
System.
So, this is for,
Chief complaint and this is for systemic.
okay, these questions. Ask, tell them, Bache.
Okay.
Face the class.
Actually, I am just going to review the systems. Like first, for general health, I will ask the
Yes, listen.
patient.
Yes.
For general health, I will ask the patient, do you feel any change in your food habits because
So
he
the
has
first heading is general health. Now I'm going to ask about general health. I would like to ask, do you
have any change in your food habits?
food habit?
And this is why I am asking this, just because he is in fever. So in fever, we may lose appetite or decrease our appetite just because we lose our taste in the tongue.
Just follow the questions.
And next we will ask how you observed any change in your weight. Did
Shabash.
it gain or it lose? Then I will ask the patient, do you feel any weakness or tiredness in your body? And then I will ask the patient, do you feel any or feel or observe fever? If it is, then how much you feel measured it at home? Further, I will ask my patient, do you have any headache? Just for the head diagnosis. And then I will ask the patient, do you feel any change in your vision? Like any decrease, any blurry vision?
This
So I will
all-
diagnose
This
the...
all comes under general health?
No, sir. This
In
is...
head and eyes?
Yes, sir.
Okay, good.
This will be under eye heading,
Eye,
just to
okay.
know any deformity, any problem in the eye.
Okay.
Next, I will ask the patient about his ear. For
Yes.
example, I will ask, do you feel any pain or any ringing sound in your ear? Mostly we will feel in fever or in really tired or fatigued we are, or in lethargy, we feel any ringing sounds in our ear.
Out exam questions. Half of the students will be asked to tell the questions asked for some of the systems. For example, half of the students here in the exam, the second part of the exam will be asked about the history, taking skills. And I will ask, okay, how would you ask questions in review of cardiovascular system? How would you ask the patient questions in regarding to ENT, ear, nose and throat? Then you will ask about ears. You will say, do you feel any ringing? Do you have any ringing in ears or pain in ears? Or is there any change in your hearing? Or do you use any hearing aids? Do you feel vertigo? I would like to explain what is vertigo. Do you feel, is your surrounding moving in respect to yourself, or are you feel that you move in respect to your surrounding? This is difference between, yes. And then there is pain and tinnitus, ringing, yes, again. So we have for nose, throat, nose, mouth and throat, basically. Okay, anyways, for nose, do you have any recent bleeding episodes
Yes.
from your nose? Do you had any previous episodes of sinusitis? If the patient has previous episodes of sinusitis, he or she will tell. Okay, bache, like that. Go for the cardiovascular.
Yes, sir. So I have just written one point for
Okay. good.
Yes.
Okay, then continue.
For tongue, I will ask the patient, do you feel any bitter taste even when you eat any dessert or any sweet dish?
No.
No. Okay, thank you. Do you feel any awareness of the heartbeat
No.
when you lie down, when you do any hard work?
No.
Okay, in no state. Okay, thank you. Do you feel any shortness of breath?
Not specific.
No. Okay. Do you have any abdominal pain at any particular area or a whole abdomen?
I have some abdominal pain.
Okay, thank you. Do the pain radiate to the back
No.
or separates to the back?
Not radiating. It is localized pain.
Thank you.
Yes.
Okay. So after the review of a system, then we will go for the past history. In the past history, do not try to say nothing significant. So we are usually saying that nothing is. We are usually say that nothing significant, and we let it go. So basically mention about any major medical ailment in the past. If we will ask from the patient that you are suffering from any disease, then we will write on the past history and any history of operation. We can also, if we are examine the like abdomen, we will see by inspection. We will see there is any point of scar or anything on the abdomen. We will check by the inspection and. Any history of operation, if so, then type of operation, any post-operative complications of anesthesia, any history of pulmonary TB, cough in the past, any history of diabetes and hypertension which may be present earlier to this period, similar illness in the past, particularly in disease characterized by relapse and remission. Please.
So, sir, can you please tell me, have you used any prescribed or non-prescribed medicines before for your fever or tiredness?
Yes, I have used. I went to a clinic which is in our hometown, and he gave me some medicines, some syrups and some injections.
Okay, do you have any prescription?
Yes, I have prescription.
Okay, thank you,
This
sir.
is the prescription.
Thank you,
Okay,
sir.
good.
Sir, can you please tell me, do you have any past history or do you have any disease like diabetes, like you have any high blood pressure issues?
No, I don't.
Okay, no blood pressure issue,
No, I don't.
no heart issue,
No.
and no disease like hepatitis, like anemia.
No, I don't have.
Okay, thank you. Have you gone through any surgery before?
No.
No, no type of surgery. Thank you, sir.
So in the past history, we will ask some comorbidities like hypertension. If the patient has any case of hypertension before, diabetes, smoking is. We will also ask it in the social history, but we will also ask in the past history that you are doing the smoking or alcohol. Dr. Maham will tell us how we will ask these questions, and if any case of asthma, TB, allergies, anemia, jaundice, typhoid. Okay, please.
Okay, thank you. Sir, can you please tell me, have you used any prescribed or non-prescribed medicine before?
Yes, I have used some medicines. I went to a clinic which is in our hometown, and he gave me some medicines, some injections, and some syrup.
Okay, thank you. Can you have any prescription?
Yes, I have.
Okay.
This is the prescription.
Okay. Thank you, sir. So you have been using saffron from Thank you. Sir, can you please tell me, do you have any high blood pressure issue before
No, I don't have.
or now?
No, I
Okay.
don't have.
Have you checked it? Or go for regular checkup for that?
No, I didn't check it, and now I have the problem of hypertension.
Okay, do you have any issue of diabetes?
No, I don't have.
Okay. Is there any heart issue?
No.
Okay. Or Do you feel any allergic to any specific medicine? Okay. Do you smoke? Can you please tell me? No. Do you use any alcohol or any drug?
I don't do.
Okay. Then we will go for personal history. In the personal history, if we already asked from the patient that in the marital status, we already asked, then we will not go for it. If we don't go for it, then we will ask, are you married or unmarried? How many children you have? Status of children, spouse and children. What is your dietary habit? Any addiction? Then are you doing the smoking, alcohol, betel, tobacco chewing? And what is your sleep timing? Like how many hours you are sleeping in a day? And what is your are you sleeping in the night or not in the night, in the day? Because some are sleeping in the day and not are sleeping. They have job in the night. That's why we will also a bowel habit, bladder habit to be mentioned here. If not mentioned in a history of present illness, in abdominal case, bowel habit, bladder habit mentioned in present illness. Socio-economic status, that the person who come to us who is poor, average income, high income group, that is more important. And in personal history, in female patient, if the female patient is there, then we will ask menstrual history, age of menarche, when the menses starts, in puberty, cycle, duration of period, amount of blood loss, last menstrual period. In postmenopausal women, mention the time of menopause. And in obstetrical history, number of pregnancies, gravida, number of abortions, number of live births. In male, how many male and how many female children you have. Mode of delivery, either there is a C-section or either there is a normal delivery. Last childbirth, any complication following childbirth. Please.
Okay. I'm going to ask you a personal history. Can you please answer?
Yes.
Okay. So actually, I have asked about all the questions: the marital status, the address, the name, the age, gender, and now I will just go through the sleep disturbance. As you told, you are a student. So, do you have any sleep disturbance?
Yes, I have. Sometimes I have sleep disturbance because, as I asked, that I am a medical student. So sometimes due to some assignments and some work, I have sleep disturbance.
Thank you.
In the family history, do not write as family history nothing significant. Instead, write as if parents are alive, write the status of health of the parents. If parents are not alive, write when had died and what was the disease he or she had of. And then we will ask about the siblings, number of brothers, sisters, and their health status. In some hereditary diseases, example, carcinoma of breast, polyposis coli, take history of 2 to 3 generations for similar disease or related disease. Like we will ask about their parents, then we will go for grandfather, grandmother, if they had this type of disease or not. Please.
Okay. So I'm going to ask you about your family. Can you please tell me?
Yes.
Thank you. So, are your parents alive?
Yes.
Okay. Are they healthy?
Yes. Alhamdulillah.
Thank you. Can you please tell me about your siblings? How much you have brothers and sisters?
I have 2 brothers and 2 sisters.
Okay. So, can you please tell me, is there any disease that runs in your family, like tuberculosis, like diabetes mellitus, or diabetes, or some heart disease like heart attack, or
No,
some
there
else?
is no history of any disease.
Okay, thank you. And do any of your family members died of any disease like
No.
heart? Okay, thank you.
Okay, then we will go for treatment history. Treatment received. If the patient treatment received so far for the present disease, what the disease patient has or have, they took the medicine for it or not. Any other medication for other diseases, and then we will go for any history of allergy to drug or food and immunization history. Okay, sir.
Done?
Yes, sir.
So
Now.
I want to take the vitals now.
Mairaj and Dr. Arslan to come on the stage and tell us how we will take the, we will do the physical examination.
Ajay, 5 minutes.
Yes.
Thank you, sir.
Last 5 minutes. Last 5 minutes.
Yes, sir.
In the mid, also okay. In the mid is also okay. थोड़ा सा इधर ले लो. Okay. ये mic दे दो. डॉक्टर को दे दो. quickly बच्चे को.
Yes, sir. So in physical examination, first we will do the general examination and we will check all these things and Dr. Arslan will tell us how we will ask or do the physical examination.
Assalamu alaikum. My name is Dr. Arslan. I'm here to examine you. Please allow me to examine.
Yes, of course, you can do.
Yes, in physical examination we check the face of patient, any deformity, and the walking, by walking the patient, the gait, check the gait, and hydration status, cyanosis, and peripheral central cyanosis, and ask the patient about nutrition status. And
So are you also going to perform examination? Are you going to perform?
Yes, if I perform, then it will take so much time. Checking jaundice.
Okay. So during general examination, you are going to check the mental status, consciousness, alertness, and cooperation of the patient. Then the physical build, please, and then face. Faces, what is faces?
So external, general
General
examination.
examination of the face, appearance, then gait, decubitus. What is decubitus?
Sir, posture.
Posture, how patient.
Decubitus is not the patient on the bed, the position of patient on the bed,
Yes, sir.
lateral decubitus, and hydration status, nutrition, anemia or jaundice, if there is cyanosis or clubbing, and then edema and neck veins. Then cervical lymph node, any obvious deformity, any pigmentation, and then I will go for vitals.
Okay. Then we will go for local examination. The mention the region that is to be examined in local examination. Example: local examination of abdomen, local examination of breast, local examination of inguinal-scrotal region, etc. Write details of local examination which will vary according to the region being examined. Like we will do examination headings are inspection. First we will do the inspection, then palpation, inspection by eyes we will do, and palpation by hand. I will palpate the area, like if there is abdomen, then I will palpate from the hand, and then we will do the percussion by tapping. Then we will, with the help of stethoscope, we will auscultate or listen the ball sounds. We will also listen the heart sounds. So, in the systemic examination, this system includes system other than the mentioned in local examination. Do not write systemic examination. No abnormality directly. Better write in brief about each system. Inspection. In inspection, first we will see the counter of abdomen. There is a flat, scaphoid or distended abdomen or not. Position of umbilicus. There is a central, deviated, everted, inverted, pushed up and down. Ascites. If there is a ascites, may cause the umbilicus to point toward the feet. That is a tenual sign. Movements of the abdomen. We will also check the movement of abdomen by the inspection. There is a respiratory, peristaltic, pulsatile movement or not. Skin over the abdomen, any scar, pigmentation, venous engorgement on the abdomen or not. Any obvious swelling, brief description of the swelling. And if there is any hernia, then we will check the hernia sites. Any expansile impulse on cuff or not. External genitalia, we will also check if there is any problem there or not. Then we will go for palpation, superficial palpation. We will check the temperature, tenderness, any muscle guarding and rigidity, any swelling there or not. Deep palpation, any tenderness in any of the deep tender spots, any other sites of tenderness. So then we will go for further auscultation, and we will check in auscultation bowel sounds or any added sounds. Then we will go for per rectal examination, per vaginal examination if applicable. So in the examination of respiratory system, we will same things, same step we will follow: inspection, palpation, percussion, auscultation, but different things we will see here. And in the summary of the case, after the taking the complete history, then we will go for summary, and Maham, Dr. Maham, come here and
Give us 1 minute summary.
Yes, sir.
Okay, stand there. It's okay. Stand this way. You can also go beyond the patient. Patient just stand there, okay? Or sit down on the table. Okay, quick summary. Shabash, finish.
My patient name is Haroon Arslan. He is 23-year-old male, a student from Ichman, presented with fever for last 10 days and loose motion for 6 to 7 days. History of present illness includes patient started having fever 10 days ago, which was high grade without triggers or chills. It is continuous. It is accompanied by body aches and pain. For last 4 days, patient is passing loose stools 6 to 7 per day and 1 to 2 per night without blood and mucus. There is no history of headache, vomiting, ear discharge, sore throat, cough, chest pain, or burning menstruation. His history of past illness includes there is no history of hypertension, diabetes mellitus, or TB, any operation, or any admission to the hospital. His personal or social history includes he is a student, he has no habit or addiction to any drug or any smoking. Sleep is normal, appetite is good before, but with his illness, his appetite decreased. House surrounding is satisfactory. Family history. Both parents are alive and healthy. He has 2 brothers and 2 sisters, all are healthy. No family history of any inherited disease. No family member died of any disease. His treatment history includes he has taken treatment from local doctors in the form of injection, tablets or syrups, but he got no benefit from that. One of his prescriptions show he was given Septron, Nivaquine or Bonston. On general physical examination, I observed a young man of normal build, laying comfortably in bed. Pulse is 86 per millimeter. Regular BP is 118 by 66. Temperature is 101.2 Fahrenheit or 38 to 39 degree centigrade. Respiratory rate is 22 per millimeter. He looks pale. There is no cyanosis, jaundice, clubbing, koilonychia, or no sphincter hemorrhage or palmar erythema. Throat is not congested. The probable diagnosis include he may have enteric fever, and the differential diagnosis I will do for the differential diagnosis. What I suggest are malaria, TB, and UTI, urinary tract infections. And the investigation which I would like to do for that are CBC, urine analysis, blood and stool cultures, typhoid test, and chest X-ray. Slide for malarial parasites and even tuberculin test and liver function test. Anti-nuclear test or anti-nuclear factor and bone marrow to be done if all above mentioned tests are not beneficial.
So,
Last, I would recommend a treatment plan for my patient that would include, as it is a bacterial infection, so I would like to give him antibiotic treatment, and these include azithromycin, ceftriaxone, or ciprofloxacin.
Continue with it. It's a huge courage to stand here in front of everyone and not to make mistakes. But if you are making mistakes, it's natural. Absolutely natural. Okay, thank you for your time and for your knowledge that you have shared with us. What's the next group?
yes. So thank you so much, sir, for giving us.
You are most welcome.